So my name's Mr Michael Magro. I'm a consultant obstetrician and gynaecologist. So I think there are lots of reasons why I chose to become a doctor. Um, but if I'm truly honest, I think the main reason was actually when I was very small, and I used to go to see my general practitioner, and I was always very impressed that you would go to see this person feeling unwell, feeling sick, and they would actually be able to make an assessment and do something, and you'd go away feeling better. And as a child, I always thought that was a bit like magic. I thought it was very impressive that you would go and see this person and they would make you feel better. And that was one of the things from a very young age that actually I wanted to go into doing something like that. So the reason that I chose to go into obstetrics and gynecology was mainly because you get to see women through what I call a life course approach. What I mean by that is actually women might present to me as young girls, as young women with irregular periods, heavy, painful periods. And not only that, I'd see them all the way throughout their life. So I may see them with problems with polycystic ovarian syndrome, difficulty conceiving, helping women get pregnant, potentially recurrent miscarriage. For those women that are lucky enough to get pregnant, I see them in the antenatal clinic, I'll perform their delivery. But then after that, we'll also see women who may come and see me at a later age with fibroids or endometriosis or pelvic pain. Then later on in life, people will come and see me with symptoms of the menopause or HRT requests. And then later on, women may get problems with the vagina, vaginal atrophy, problems with sexual intercourse. And actually, what I really enjoy is being able to see women throughout their lives, right from a young age, right away until they're older, and actually that huge number of conditions that really affect their quality of life throughout that time period. I think the thing that I find most rewarding about my job, especially being that the majority of it is a surgical specialty, is actually being able to make a significant difference in quite a short period of time and actually seeing women's lives change for the better. So it may be someone who has had heavy periods for years and years and they haven't seen anybody, and they come and see me, and quite quickly you're able to offer them a variety of treatments that actually their symptoms may improve quite quickly, may be that medical or surgical treatment. And actually, being able to see that their quality of life has changed dramatically in a short period of time is really the most satisfying for me. And also, I think what the women appreciate a lot. So, the thing that I think my patients value the most about me, and this is what often comes back in a lot of my feedback, is that I offer them a variety of different options. And I really try to hone in on what their main concerns and issues are. So again, if we're talking about someone with, let's take fibroids, for instance, then they may come in and someone may consider that their heavy menstrual bleeding is their problem. But actually, the main problem for the women might not be their bleeding, it might be their pain or the fact that their tummy is really distended and they look pregnant. It may be that it's pushing on their bowels. It may be that they're concerned that the fibroids affecting their fertility. And I think one of the things that a lot of my women and patients say is that I spend time trying to really understand how the problem affects them and their families, and therefore I can actually tailor the treatments and individualize it to them. In terms of what I value most about my patients, I think it is seeing that feedback. It's seeing the difference that you can make to the wider family, to them. And actually, when someone walks in the door after having had their operation 6 weeks later, and the first thing they do is smile at you, and you think, yes, okay, that is, you've made a difference. I'm really pleased. You can tell this has changed their life. And actually hearing their stories and receiving that feedback is the thing that I value the most.